Dr. Groves, my back is killing me. I hear that all the time. And I feel so sorry for patients whenever they have low back pain, especially early in pregnancy, because it can be a little bit discouraging when you have so long to go. In the first half of pregnancy, less than 20 weeks, low back pain is typically due to hormonal joint relaxation. In the second half of pregnancy, it's a combination of those joints being relaxed and starting to move, getting prepared for delivery, and the postural changes as the abdomen protrudes and then the low back has a sway to it. So, danger signs for back pain in pregnancy that you would want to let your provider know would be fever, rhythmic low back pain that might make you think of labor, vaginal bleeding, burning with urination, blood in the urine. If it's not those things, then it's typically safe to use some massage on the low back, some gentle stretching, heating pad on the low back, warm bath, Epsom salt bath can be helpful. Magnesium through Epsom salt bath can help. Also a magnesium pill, which you could get off of Full Script, which is there's a link on our website for that if it's a chronic issue. Gentle chiropractic manipulation can be safe in the hands of a skilled provider. Also, massage therapy can be helpful. A belly band to support the abdomen can help. And also a zero gravity environment such as a swimming pool or a hot tub that's not super hot, or bathtub that's filled up. So those are the things to get started with. Hope this helps. Also for that low back pain, topicals such as Accuplus or Icy Hot are helpful and can be used as an adjunct to massage.